Welcome everyone. How are you all doing today? Happy Sunday, wherever you are. Today I'm being joined by Dr. Sheyi, who is a fertility expert. He will be speaking on male factor infertility. So do share the link with your friends to join us today. Thank you all for joining us. Hello, how are you? Please let us know where you're joining us from as well. Male factor infertility. Our topic today is male factor infertility. Welcome, Dr. Sheyi. He'll be. Ooh, sorry. Thanks for letting me know. Is it better now? Male factor infertility. Dr. Sheyi, please send a request to join. Adiola, is it better now, the volume? Hello, Z. Thanks for joining us from Kent. How are you doing? How are you all doing? Welcome. Thank you for joining us. Please send invites to your friends. Dr. Sheyi, could you please send an invite? Okay, great. Or request, rather. All right. Hello, MRKH Mary. Thank you for joining us. Hello, the Luxury Backshop. Cialis. Hello, Dr. Sheyi.
Hello, how are you?
Good, thank you. How are you doing?
I'm fine. How are you too?
Wonderful. Happy Sunday, as we say in
Yeah.
Nigeria. Thank you for joining us
Can you
today.
speak louder?
Who, me? Oh, I'm
Yes.
speaking.
The sound your voice is so cool. Maybe it's your environment anyway.
Really? You can't hear me?
I can hear you, but it's a bit low.
Really? That's strange. Is it strange?
Can you hear me
Yeah,
very
I can
well?
hear you. You can hear me well?
I can hear you, but I don't know. It seems low.
Oh, that's strange
But at
because on the
least,
Max on the phone, that is so
yeah,
strange. Okay, let me try to
it's
see
alright.
if I join in on my other phone. Um,
I
okay,
think we managed it. And, okay. They said they can hear us both clearly.
okay,
All right.
all right.
It's all right.
So, Dr.
Okay.
Shea, let's start off by saying maybe perhaps you do a little introduction about yourself.
I can what?
Your introduction.
Oh, all right. All right. I'm Dr. Adelekun Oluseyi. I'm Dr. Sheyi for short. I'm a consultant gynecologist and also a a fertility expert. I've been practicing in this field of obstetrics and gynecology for more than 12 years now. And I think about 4 or 5 years ago, I decided to start online presence because I found out that a lot of problems in obstetrics, a lot of pregnant women, or a lot of couples are trying to conceive. I found that their major problem is because they lack the right information. Information solves a lot of problems. Knowing what the problem is comes from information. Knowing the solution to problems comes from information. So that was why I started Ask Dr. Shea on Instagram, on Facebook, and a little bit on Twitter. So, and over the years, I've tried to give information to people, online consultation, physical consultation, and the rest. So that's a little bit about me, for short.
All right. Thank you so much, Dr. Shea, for that
Yeah.
intro and for all that you're doing to support people trying to conceive. So
I'm really
today,
finding it hard to hear you. I don't know why. Your voice is so cool.
really? Because I'm on the max.
Yes.
Okay, so for everyone else, please, can you hear me?
But it seems everybody is hearing you. Anyway, I'm straining to. I'm getting you, but I will have to ask you over and over. But let's
That's
continue. Let's continue.
that's interesting because it's on the max. Literally, you can't go louder. Can
All right.
Let me see for other people in the chat, please. Can you say if you can hear me clearly? Yeah, so I'm not sure what's going
Fine. It's
on.
all right.
Yeah.
It's okay.
All right. I'll try to repeat the question if
All
needed,
right.
anyways. Okay. So I just wanted to say, firstly, for us to start, uh, I think in back in the days and even now, reality is that when people are trying to conceive, the focus is usually on the woman.
Yeah.
Perhaps because it's the woman that actually gets pregnant. So you hear many cases when people are struggling to conceive, people focus on the woman, people look at the woman and give advice of what she can do and what next. But we're also seeing that globally, male factor infertility is actually rising. And it's even said that when couples are trying to conceive, couples with men and women, when they're trying to conceive, you're actually realizing that about 50% of the cases actually male factor infertility. So could you tell us, Dr. Shea, about male factor infertility? What is happening? Why is it rising? Just to give us a little bit of brief about that.
All right. A lot of people have not been taking closer look at male factor when it comes to managing couples, and it's I think it's general. Churches will ask women to come for prayers. They have a day in the week that you have to come and pray. Health professionals too. They look at the woman more than they should look at the man. Families they will put pressure on the woman more. I think it's the society, but it's the truth that the both men and women, they contribute the same equal amount percentage to infertility. If you have 10 couples, 10 couples trying to conceive, 4 of the problems are from the women, and 4 out of the couples we have from the man. And about the remaining 2, maybe 1 or 2 will be from both. And maybe 1 can just be what we can say you are not sure of what the cause is, unexplained. And over the period, it has been increasing. Majorly, 1, because of over the years there have been advances in a lot of things. 1, we have people's orientation are changing. We have more fertility clinics. We have more people going for consultation now. People are changing orientation, so we are able to see more men that, okay, though it's still low, but more men are coming out. So we are getting to know that, okay, men have more problems than we envisaged before. Then the lifestyle changes that we have now. People are eating more of junks. Junk foods are easy to eat
Yeah.
than good food. If you want to, you can just buy cake, you can buy meat pie and take a soft drink on it, and you are fine. Why for you
Yeah.
to eat a good meal with vegetables, have good maybe chicken, fish, it's a bit expensive. So it has made it's making male infertility more serious because people are getting fatter. Obesity is rising among men, and once obesity is rising, it has its own problems, which has to do with fertility. Also, there are some chemicals now. In those days, there wasn't anything like pure water. Nothing like bottled water. Just take your water from the source and drink your water. But now there are plastics. There are pure water. As cancer is rising, they call them hormone disruptors. There are some of these things in the chemicals, in the plastics, in the bags, that are called hormone disruptors. It does affect the normal hormone milieu. such that it affects fertility of men. It even affects that of women too. Then the work people are doing now. We have more people in IT. We have people going to industries, working in industries, especially there's some industry that has heat, is an heated environment, and heat is not good when it comes to sperms. It is very, very bad with sperms. So it is also affecting men one way or the other from that. So then people are getting older. People are getting older before they get married. In those days, by 21, 22, people will have gotten married. Now you get people getting to 40 before they get married, 35 and above. In fact, there are men that are 45 and now and are not yet married, and they don't have any kids. And as you age, your fertility decreases, both in men and women. It's more pronounced in women anyway, but in men it decreases as you get older. So over the years, because of improved lifestyle, improved socioeconomic factors, people eat junks more. People can afford to take, they have more of bad things now, bad drugs. They have entertainment drugs, marijuana, cocaine is on the rise, cigarette smoking, alcohol is on the rise. People take a lot now, and then people go into building muscle buildings, taking steroids, So a lot of things are accounting for why male factor infertility is on the rise. A lot of things. In a nutshell, those are the reasons why male infertility is on the rise.
Thank you so much
Yeah.
for highlighting that, all those factors for us, Dr. Shi. I think that we don't realize, like you said, so many things have changed in terms of lifestyle.
Yeah.
We don't work as we used to before now. People have a lot of cars, so obviously we're not
Yes. Yeah.
exercising and we're eating.
Right, that sedentary lifestyle.
Yeah.
But not exciting like before. You rather take a car for you to walk about 15 minutes. You rather take your car and drive to the place instead of walking. And those were the things that, and in those days we have more farmers, we have more workers doing stressful jobs. Now we do more of office work. You sit down more. Information technology is taking over, computer is taking over. Men, you carry laptops on your thighs a lot. All these things, phones, radiations everywhere. These are the things that are increasing infertility in men, and it's making it to be on the rise.
Thank you for
Yeah.
sharing that. So hopefully that we're all hearing this and we can, men that are listening, make these changes, and women that are here, tell our men, our brothers,
Yeah.
all the men that are in our lives. Uh, so, of course, again, talking about male factor infertility in couples, oftentimes when people are going to try to conceive, like we said earlier, they're going to the doctors, but usually the woman is the one being tested. We also know that men can feel that, well, since they see sperm coming out, or perhaps they see semen coming out, they ejaculate when they have sex. So to them, that means they're fine, right? So if something is coming out, then obviously I have sperm, is the general belief. But can you tell us about that? Is that just because you see an ejaculate when you have sex or whatever the case, does that mean everything is fine? Or what do our men need to be doing to check to ensure that if their sperm is fine or not?
Yeah. Semen contains water and cells, sperm cells, and the sperm cells are so minute that you can't see with your physical eyes. And so if a man just say I'm ejaculating and thinks because I'm ejaculating I'm fine, it's not true. In fact, if a man has impregnated women before, years ago, maybe he has a child, the child is about 3, 4, 5 years old, anything could have happened within the past 3, 4 years that could have affected the sperm concentration, that could have affected anything, the production of sperms. So the fact that semen is coming out doesn't mean that a man is fine. There are a lot of things that could have happened over the years. The man would have aged, I mean, there would have been an increase in his age. And as you grow older, especially when you are getting close to 40 and above, your sperm concentration, your sperm count, your sperm motility start reducing. If you are less than 40, the percentage of your testes that is producing sperm is maybe close to 90, 100%. But as you grow older, it starts reducing. By the time you are 40, it's about 60% production capacity. And by the time you are getting close to 70, 80, it's about 10% capacity. So men are still producing sperms, but the production capacity starts reducing as you age. Then the fact that people are taking cigarettes, even not even taking cigarette directly, if you are moving with cigarette smokers, because some people tell you that they are not smoking, but they are moving with smokers. You know, when you move with smokers, you are a secondary smoker. That means you are getting more of the chemicals than the person that is even smoking. And those chemicals, they affect sperm production. Then temperature effects, you know, some people take, they take, I mean, they bathe with hot water every time, use nylon pants. Some men are still wearing pants, especially nylon pants. This increase the heat around the scrotum, because the way the sperm, I mean, the way the testes are located is outside the body, and it's there for a reason. It's in a pocket which is called the scrotum. The testes, a man has two testes, and inside those testes, that's where sperms are being produced and they are stored. You know, so, and they are important for sperms to be produced optimally. Temperature is very, very important, and that's why when you are in hot climates or hot weather, the scrotum dangles away from the body. It stays away. And when you are in cold climate, it gets closer to the body, just because it's trying to regulate the temperature. So all this affects the sperm concentration. So the fact that a man is ejaculating, having sex is ejaculating, there are some that may not even have any sperm in it. Because before sperm is produced, apart from sperm, there are other things that are added to the semen. Water is there. The prostate adds its own content to it to nourish the sperm. So the sperm can look like it's still that palm wine color, but it may not be that. It may be that the semen, the sperm cells inside are little or none. And you know, all these things, the only way to know, the major way to know, is to do a sperm test. If you don't do a sperm test, you cannot know if you are releasing semen, if it's fine or not. So majorly, you have to do a sperm test before you can
Okay.
say you have before you can know the status of your semen.
Okay. So thank you for highlighting that, Dr. Shea. So our men should be going to get a sperm analysis done, and that would.
Yeah. If you are trying to conceive as a man, if you are trying to conceive, it doesn't even matter if you have had a child before, if you have had children before, if you have impregnated women before, as long as you have had a little space. Even a period of 6 months can change anything. A man can get sexually transmitted infection within a period of 6 months, and sexually transmitted infection can affect sperm production. It can even affect the pipe that sperm passes through. It can block it if it's not well treated. So a man could have had infections one way or the other. It could have had the effect of temperature on the sperm could have destroyed the sperm. You know, a lot of things could have happened. So the fact that you feel that, okay, I've been pregnant, because that's one of the problems we have with couples. You know, when the woman comes to you, you tell the woman, I need to check you and your husband. I said, doctor, check me first. Leave my husband. My husband has impregnated a lot of girls in the past. He even has a child, and one will be telling the woman that I don't have a problem
Yeah.
because I have impregnated. I have children. The fact that you have children doesn't mean that you cannot have a problem. And that's why we have a lot of problems when we come, a lot of difficulties when we deal with men, when we are dealing with couples trying to conceive. Yeah.
Thank you for speaking on that, Dr. Shea, because that's, again, lots of people say that. I've had a child
Yeah.
before, and so obviously it can't be me. And like you said, fertility can change at any point in time. So we should all be getting tested. Now, speaking about sexually transmitted or infections that you mentioned, what should our young men be doing? Young men that are sexually active, how should they be ensured? Because I think that when you're not planning to have children, when you're not thinking of having children, when you're really young, maybe 18, 21, whatever the case might be, you're not really thinking about fertility. But how should our young men be protecting themselves while they're being sexually active to ensure that they can do all within their own power to protect and preserve their fertility?
Yeah. The first thing is to prevent yourself from getting infection. And the only way you can do that is to use protection. Protection, apart from the fact that it prevents pregnancy, it prevents infection. It prevents infection. Using condom goes a long way to prevent sexually transmitted infection. It prevents HIV infection. And once you can do that, at least it doesn't prevent all infections, especially when it comes to human papilloma virus. But when it comes to infection that can affect fertility, it prevents all the infections, gonorrhea, chlamydia, because these are the infections that destroys the testes. So it prevents infection. And one thing also is, once you feel that you are infected, maybe you have pain when you pass urine, you are having pus discharge from the penis when you are peeing, or even when you are not peeing, you're just pus coming out from the penis. That's a sign that there is infection. You are urinating frequently and it's paining you. It's a sign that you may be infected, especially if you are sexually active. And once you have such, you need to go quickly to a doctor, not a chemist, because that's one of the problems that we have in developing countries. People just walk into shops, a pharmacy shop, and they just give them all sorts of drugs. But you should see a physician that will test you and know what the problem is and treat you appropriately. Because one of the problems is people are not treated appropriately. That's why they have problems later. There can be blockage of the pipe that carries urine. Then they start having problem when they want to pee. It takes a while. Sometimes it may not be easy to pee again. Sometimes when they pee, instead of it going straight, it forks out in different, maybe because of the blockage, different blockages that have happened in the pipe. So once a man has that kind of infection, you should go to the hospital and get treated. Then young men, when they have there's something we call parotitis.
What's that?
It affects young men, young boys, adolescents. When it affects adolescents, it should not be taken lightly.
What
It
is it
affects
exactly? What does it do?
parotitis.
Like moms?
Parotitis.
Or
Yeah, it's moms. Yeah,
moms?
moms.
Right. Okay.
Yeah, moms. So if they have something like that, they should not just say okay and start treating. You should go to a doctor and let the doctor see you and treat you appropriately, because the moms can later affect fertility, can destroy the testes, and can make the boy not to be infertile later in life. So it's important. So when you have things like that, you must make sure that you get to see a doctor, not just go to a pharmacy where they will just give you all sorts of drugs. Then another important thing is scrotal swelling. Especially in young men and boys, you can just have their scrotum will just get swollen up and be painful. I've seen few that the parents will just take the boy to a chemist And when they take the boy to a chemist, the chemist will give antibiotics, will give paracetamol, give diclofenac, and once the pain is relieved, the boy is fine. But the sperm, the testis is dead. Because what causes the swelling, the testis is attached to the body through a stalk. That stalk has blood vessels passing through it. It has nerves, it has lymphatic vessels passing through it. Now, when sometimes the testis twists on its stalk, when it twists, just like when you have fruits, fruits dangling from when it twists, you know. So once it twists like that, it blocks the vessels, the blood vessels, such that blood is not getting to the testis. And once blood does not get to the testis, there is no oxygen, there is no nutrients getting to the testis, because it's a living tissue and it needs oxygen, it needs nutrients to nourish it. So once it's not getting there, it starts to die. So, and once you have that swelling, you have to get to the hospital within 6 hours.
Wow.
If you don't get to the hospital within 6 hours, and everything must be resolved. You get to the hospital, they confirm it, you do the surgery, you reverse it, and prevent its occurrence again. If you don't get to the hospital within 6 hours, the likelihood that testis will survive is gone. And if care is not taken, it affects the second testis.
Wow.
And that's will be the end. We have had a lot of guys that are infertile now. They don't have any sperm production again because of that. And because parents don't take note of such, even those that take note, they will just, take the child to a pharmacist or a chemist, which will not help the child in any way. What will have helped will be, what should have been done is to confirm that it's scrotal, testicular torsion, and go and reverse it surgically. It's surgery that can sort out that. So, but for preventing infections, use condom. Then know your status, your partner. Know the partner status. Know your status. Then, when you get infected, get treated as fast as possible by a doctor, not just go to any place where you will not be well taken care of.
Thank you so much, Dr. Shea. That was really informative, and that's actually quite scary, the swelling, to see how quickly it needs to be resolved. Yeah. And I think we certainly need more.
Yeah.
When you go to the pharmacy, like you said, if you do get an antibiotic and the symptoms are no longer there, people are going to assume that everything is fine and that they're okay. So it's interesting that the symptoms could go away, but the issues could still be there.
Yes, it's possible, because there are some antibiotics that may work and may not be totally. Before you do antibiotics, you have to use it. You have to do a test to know what kind of antibiotics can kill the organism, what type of organism is it, then what kind of antibiotics should you use, and people just give, pharmacy chemists, they just give broad spectrum antibiotics, which will kill to an extent, but may not totally kill everything, Okay. Then the timing, some people will wait 1-2 weeks before they go out, before they start speaking out, and during that time it will have caused a lot of damages. Also, it's also important that by the time that person is being treated, the sexual partner or partners must also be looked for and treated, because even after you have been treated and you go back to the same person who was not treated well or not treated at all, you still get the problem again. So it's not going, it won't have gone. So it's still the same thing over and over and over and over again. So that's why it's important to see a doctor that will know what to do, trace the sexual partners, treat them appropriately, and know the kind of drug to give. That's why it's very important.
Thank you for shedding more light on that, Dr. Shea. I think we have a couple of questions in the comments. So perhaps I'll ask you those first before we continue. So someone here said that maybe the last one, what happens when a man only lasts for 2 to 3 minutes at most, and most times not opt for the second round, and can pregnancy still be achieved regardless of the length of time?
You don't need to last. You don't need to do 20 rounds to get a woman pregnant. You don't need to last 20 hours. You can. There are people that have been raped that the man did not even penetrate, just deposit on the vaginal entrance, and the person got pregnant. It's not about the number of times you last, as long as you ejaculate, and that ejaculates, and it contains sperms. It's not just sperms alone. It contains the adequate amount of sperm. The number is adequate. The sperm can walk, can move fast. It can run fast. Significant amount of them can run fast, and significant amount of them are normal looking. Those are the three important things. The amount of the sperms, they are adequate, they can move forward and fast, and they are normal. So it doesn't matter, as long as you deposit the semen in the vagina, the person will get pregnant. It doesn't matter if you last 2 seconds, 1 second. The most important thing is the deposit. When you have sex, do you deposit? Do you ejaculate? Are the ejaculates containing the right amount of sperm? The status of the sperm, are they fine? So it doesn't matter the length of the intercourse. What comes out during the intercourse is what matters.
Okay, yeah. Thank you for saying that. And just to be clear, we cannot actually see the sperm, so we can't see if it's moving or moving forward or not. That's all done at the lab to actually check.
Yeah.
And there was a previous question before the one we just had now, so I just want to go back to it quickly. I'm not sure that's about male factor, but someone I just noted here, if there's pain in the belly button, is that a sign of infection? So I'm not sure that's belly button for a man, and also what causes recurring infection. I'm not sure if that person is referring to man or woman.
If you have pain at the belly button, it could be anything. It could be appendicitis, it could be any kind of infection. If you have pain at the belly button, you need to go and see your doctor. You need to see. Let the doctor evaluate you, know what the problem is, and treat you appropriately. Okay. So it may not even be related to the sperm or anything. It may just be something else. Yeah.
Okay. And the most recent one here is why is the sperm not reaching the fallopian tube even when both tubes are open?
Yes, like I said when you ejaculate, the semen, the sperm is not just having sperm, it's having the normal amount of sperm and the normal amount of sperm that can move. The sperm can either move forward fast or move forward sluggishly, or move in a circular fashion, just in circle, or just move on a state, just stable in a place and just be moving, or not moving at all. The one that can get a woman pregnant is the one that is moving forward and fast. If your sperms are not moving forward and fast, the sperm will not get to the fallopian tube. Because once the ejaculate is deposited in the vagina, the sperm start moving immediately. So if you don't have sperm that can move, the sperm will not get to fallopian tube. That is why you must do a sperm test to know the status of your sperm. You need to know the count of your sperm. You need to know the amount that are moving well. You need to know the amount that are normal. These are important things you must do before you can determine what the problem is.
Okay. Thank you, Dr. Shea. I have a question here that was sent before this session. The person is saying that her husband has been diagnosed with azoospermia. And is there, what is that? And is there a solution to that? Can that be resolved?
It depends on the cause. It's based on the cause of the azoospermia. Like I said, is the person drinking alcohol? Is he smoking cigarettes? Is he on drugs? These are the things that can cause azoospermia. Does he have infection that should be worked on? Has he had testicular torsion in the past? Or does he not even have normal testes? These are important things that must be looked at. How are his hormones? Are his hormones fine? Does he have prolactin problem, testosterone problem? Does he have thyroid problems? These are things that will be looked at first before you know, okay, what are the other things? The pipe that brings sperm, are they okay? Are they fine? Are they open? Are they normal? These are the things that will be looked at first. If you look at it, then you can now say, okay, what is the problem? If it is something that can be resolved, there are
Right.
sometimes that if you use drugs, it can resolve it. If it is something that has not damaged the testis permanently. But if the testis has been damaged permanently, then there is no, the only option is to have a sperm donor. There are some other things that can be checked. The testis can even be checked to see if they can get, even if it's one sperm or two sperms that can be gotten out from that testis, it can be used to inject the egg through ICSI. But if it's not possible to get it, then the option is to get a donor sperm. That, though, is not something that a lot of people want, but it is still better than not having anything. Nobody will know you went for a donor sperm. You can get a donor sperm from a relative that is close to you if you are fine with it. I've had situations that we have to get sperm from the father of the child and use it for IUI or IVF. You can get from the brother, as long as you are okay with. If you have people that are that close to you, then there are some donors that we can get from somebody that you don't know. Things like that. So, but the person needs to actually be evaluated. Check the hormones, check the testes. Are the testes fine? Are there problems with the testes? Are there things that one should check? So once it has been resolved, if you give drugs, is there any improvement with the drugs that we are giving? If there is none, then there's really nothing anybody can do than to think about using donor sperms.
Okay. Thank you for answering that, Dr. Shea. And just for people that are here now watching us, I just wanted to share, the services that you actually provide, Dr. Shea, and how you can help individuals and couples that have male factor infertility.
You said?
I'm just saying that just since we have quite a few people here now on the call, so I wondered if you could also let us know what services do you provide for people
Oh, all
that are
right.
going through
Okay.
male factor
So,
infertility and how you can help
yes.
them.
Like I said, we can evaluate the sperm, evaluate the man generally to know what the problem is. If it's something that can be treated, we can give drugs to help to improve the sperm status. If it is not something that can be sorted out, we can do intrauterine insemination, especially if the man has sperms that are not moving well. There's something we call IUI, intrauterine insemination, which we take the sperm. What we do majorly in IUI is to shorten the distance, because usually once the sperms are moving well, within 30 minutes, we expect the sperm to get to the tubes. And at least you still expect within the space of 24 to 72 hours, sperm should still be available around to meet the egg. However, in such instances, the sperm may not be able to move adequately to get to the tubes within that period of time because they are not moving well. So what we do with IUI is we shorten the distance the sperm will cover, such that it will take the sperm a shorter period of time to get to the tubes. By just taking the sperm, wash it, there are different procedures we do to wash it and deposit directly into the woman's womb. There are some people that their entrance is affecting sperm, the kill sperm. The cervix of the woman kills the sperm. IUI can also be used to circumvent that. Then for people that they have bad sperm that IUI cannot work with, we do IVF to help them. If we cannot get sperm, we can do donor sperm for IUI, for IVF, depending on the situation. Then we can also try and check if we can get sperm cells from the testes and see if we can use it for IVF at times.
Okay.
So those are majorly what the services available for male factor infertility.
And how can people reach you? What's the best way to reach you if they want to reach out to you?
Yes, you can send me a DM on WhatsApp, on Instagram, on my handle. You can send me a WhatsApp DM, or you can send me a chat. A WhatsApp chat on 080 66 27 5937. 080 66. That's if you are in Nigeria. If you are not in Nigeria, you put +234. So +234 80 66 27 5937. So if you are in Lagos, you can see me in Ikorodu, Magodo, Ikoyi, or Lekki. Those are the places I see my clients. So you can book an appointment ahead for a physical consultation, or you can book for an online consultation, even if you are not in Nigeria. We can have had cost to send drugs to couples outside the country to help with their male fertility issue. And at least we have had quite good results. That's if it is something that can be treated with drugs. So you can reach me on WhatsApp at 08066275937, or DM me on Instagram, ask Dr. Shea. You then you'll be able to get through to me.
Okay, perfect. All right, so I had a question here. Thank you for, I've put that in the comments as well for Dr. Shea's contact. Let me see if I can pin that as well. Please check
the question.
Dr. Yeah, so I just have another question here where someone has said that, I'm just trying to go back to the top one. So is there a particular sex position that women, so there's some interference. I'm not sure what that is.
There's one that says, is there any other affordable way to achieve pregnancy aside penetration and IVF?
Okay, so after that, then I can go back to that one there. I just had
that earlier. One, like I said, IUI is the one. That's if, then IUI works if the woman's tubes are functioning. If the tubes are not functioning, then IUI is useless, because it's a form of doing a natural conception. But you are just helping the sperms. If the sperms if the count of the sperms are not enough to have a spontaneous natural conception, there is an amount that IUI can work with, depending on our evaluation. But if the tubes of the woman, if they are blocked, then IUI will not work, because it is the tubes that the sperm and egg will meet. So if the tubes are not functional, they are blocked, then there is no way the sperm can meet the egg. So in such instance, IVF is the only option. So if you don't have such, then IUI can work for you.
Okay.
So that's the other option.
Right. Thank you, Dr. Shea. I also have one here. Is there a particular sex position that women can get pregnant? Because in the situation when is there a particular sex position that women can get pregnant?
No.
So any is fine.
There's no, as long as you can deposit the semen in the vagina, whichever, even if it's upside down, as long as the semen enters into the vagina and is deposited there, the person can get pregnant. If the conditions to get pregnant are satisfied. One, adequate sperm that is adequate in count, in motility, and in shape. Tubes are functional and open. The woman is growing eggs and releasing the eggs. Then the womb is receptive to a fertilized egg. Once those functions, once those states, those parameters are satisfied, the woman should be able to get pregnant. Sometimes, even if they are satisfied, some people still have delay in conception. That's what we call unexplained infertility. Every other thing is fine, but they are still not getting pregnant. That's an unexplained. There are ways we treat those problems too. But once those criteria are there, once the semen is deposited into the vagina, any sex position, any position is fine. It doesn't matter the kind of position. As long as semen is deposited, it's fine.
Thank you for shedding some light on that. And here I have another question saying that sometimes the sperm gushes out of the vagina. So lots of people are concerned sometimes that some sperm comes out, or rather some semen comes out, and they feel that they need to put the pillow under their legs for such a long time to lie down, to make it going. So
it's actually normal for sperm to come out of the vagina. If it doesn't come out, then something is wrong. Because the vagina is just like a bucket. It's like a bucket. And when you pour water in the bucket and you place the bucket on its side, definitely water will come out. That's the way the vagina is. The vagina is like a bucket that has a hole in that middle portion. That hole is the cervix. What is important is as the sperm is being deposited, the cells are moving. Once the cell moves, the water part will come out. If it doesn't come out, then that means something is wrong. So the sex that the person has been having for life, just staying inside it will have blocked the thing now. So it's normal for it to flow out.
That's
not an issue.
Thank you for saying that, Dr. Shea, because oftentimes many of us are told there's a problem, and so we spend hours or just putting your legs up to ensure that it doesn't. Put your legs up.
It will still come out now. Put leg up. It will still come out. A lot of people that get pregnant don't do that now. It's normal for sperm to come out. It contains water. The most important thing is, are the cells moving and moving well? And once the cells are moving and moving well, there's no problem.
Thank you.
As far as I'm concerned. A lot of people get pregnant. A lot of people even get pregnant doing standing. Yes. So it doesn't really matter the position, or it doesn't really matter. So it's important. The thing that is important is the cells. Are they entering or not?
Thank you for sharing that. For everyone else that has joined us, please, we still have a few more minutes before the session is over. Please, if you have questions, male factor infertility is the topic today. If you have questions relating to that, please share in the comments so that Dr. Shea can answer. In terms of cost of IUI, perhaps you can send a DM directly to Dr. Shea afterwards, so that way he can advise better in terms of costs. Please reach out to him directly. Okay. All right, so I'm going to ask you. Yeah, go ahead.
Yeah. Continue.
Okay, so I had another question as well. I know we spoke about azoospermia. I also had another question about oligospermia, that the spouse has been advised that he has oligospermia, and they were recommended donor sperm, and she wanted to know if there was any other way to get sperm in that situation.
For oligospermia, that means there are still an amount of sperm. It's just that the quantity is not as it should be.
Right.
We still need to look at why the person is having the oligospermia. Is it eat? Is it cigarettes? Is it smoking? Is the person fat? Is the person on any drug? Even antihypertensive, antidepressant drugs, anti-epileptic drugs. Some of these drugs, they affect sperm production.
Right.
So we need to look, how is the thyroid of the person? How are they functioning? Is the person having other problems, diabetes and all those things? Once those things are well taken care of, there are some drugs that we give to help to boost, the sperm concentration. However, if it doesn't work, depending on the level of the oligospermia, there are some that IUI can work with. There are some that is IVF that the person will do. But it's after we evaluate the person that we know what to actually do. If we don't evaluate, we don't know, okay, what is actually the problem? Okay, what are the other issues? How can we circumvent or treat these issues? Once we treat them, then we can now move forward and know the next line of action. Some IUI will do. But the problem with IUI is you have to do multiple before you say it's not working. So that's what a lot of people run away from, because eventually, by the time you are doing 6, you are spending close to what you will use to do an IVF. For some people, it's just the first one that they will do that they will get pregnant.
Yeah.
Why some take about third procedure, some after 6 they don't even get pregnant. They have to convert to. So there are things that we cannot determine.
Right.
We can just do our part. Just look at, okay, what are the factors? Have we achieved all the factors? Then we can now say, then God is the only one that determines. The God factor
Yeah.
is the one that is constant for everything. Once the male aspect is sorted out, the female aspect is sorted out, then the God factor is the one that determines which one goes. So,
Thank you for shedding more light on that, Dr. Sheyi. What about herbs? Herbs and supplements. Should our men be taking herbs? Because usually there's a lot of herbs being sold, people saying that this one herb can treat any condition. As long as you take it, the person will be fine. So what are your thoughts on herbs?
first, herbs, some of them are good, but a lot of them are not good. The refined herbs, there are some herbs that have been refined by pharmaceutical companies that we use in treating male factor infertility, female factor infertility. They are refined and they are meant for that purpose.
Right.
But a lot of herbs that people use can be used to treat 20 different diseases.
Yeah.
In such, that means there are a lot of chemicals and there are a lot of toxins that are in a lot of herbs. And apart from that, it can cause other problems, kidney problems. A lot of people are coming down with kidney problems because of herbs. People take herbs a lot, and a lot of them, by the time you find out later, they develop kidney problems, they develop liver problems. So for one, I don't encourage herbs, especially any form of herbs. But there are some herbs that have been refined, that have been made into tablets, that you know that, okay, these are about. In fact, most of the drugs that we use are herbs. They are gotten from extract from plants, from herbs, and all those things. They have been refined. They have done a lot of tests on them, know the chemicals that work for this, the chemicals that work for that, and they have been put together to help people. But the ones that are just, the people just drink anything, are not for that. So, herbs has positive and a lot of negatives, which can cause liver problem, kidney problem, can even cause erectile dysfunction if one is not careful. It can cause abnormal babies in women. I've had babies that are abnormal that you now ask the woman and say, I took some herbs early in pregnancy or during pregnancy. So I can even cause recurrent miscarriages. So that's why I'm not really a fan of taking herbs, especially if it's not recommended by doctors. Like, I'm not a fan of taking herbs. Supplements are good. Folic acid, vitamin C, coenzyme Q, zinc, they are good. They are good for sperm functions, they are good for egg functions. Supplements are good. Vegetables, fruits, they are very good. when you are trying to conceive. They improve your health status, they improve your immune status, they improve your sperm production, improve egg production. Supplements, they are very good.
Yeah.
But herbs, I'm not really for herbs. No.
Thank you for speaking on that, because that's something that's become very common and popular in our society. So it's important that you let us know your stake on that. And if anyone has any herbs before they take it, they can speak to you or speak to the doctor so they can check to see before taking any herbs to ensure that it's
Yeah,
okay. Okay.
yeah.
All right. Any more questions in the comments? If you have any questions, please highlight in the comment before we wrap up. But Dr. Shay, just before we wrap up as well, I'd like for anyone listening, any final words from you for men and for us women that have men in our lives, so our husbands, our brothers, our children, whatever the case. Any final comments in terms of how we can protect and preserve male factor fertility?
Um, First, I want to talk to men that the earlier you know that it takes two to get pregnant, the better. Women clock is faster than men clock. We've had women that it took them years before they know that it's actually the husband that had issues. And by the time they are ready, by the time the man is ready, there is really nothing else the woman can do. You have to be looking for egg donor for the woman, to get pregnant. And it's not a good thing when men refuse to follow their spouses, their partners for tests because they feel they are fine. There's nothing like I'm fine. Even if you have 7 children, 10 children, there's still nothing like you're fine. At that point in time, anything could have happened. So I'm going to advise men that they should please, as much as possible, try. I know that it gives a lot of psychological effect, because when you know that you are the one that has problem, it affects the ego of the man. But at least, if you know that there is a problem, you can find solution to it on time, and it will help the woman a lot. A lot of problems are from the men. A lot of women are ready to be sorted out. Once you sort out the woman, if you are not sorting out the man while you are treating the woman, then it's useless. The treatment is useless. That is one. Then taking care of the young ones, the children, the boys, is very important. Take note of them. Anything that has to do with the testes, don't take it lightly. If you see any scrotal swelling that is painful, even if it's not painful, take the child to see a doctor immediately. Let the child see a doctor. And if there are issues that the doctor will have to deal with, the doctor will let you know. Because some of these things, it will need surgical intervention as fast as possible. If you have any infection, like mumps that I talk about, and it's a young boy, you should go and take the child to a doctor. Let the child be well taken care of and treated. If you have sexually transmitted infection, as a young woman or a young man, don't be afraid to see a doctor, because these have long-term effects on fertility. A lot of women are dealing with blocked tubes now because they didn't take care of their sexually transmitted infection well. When you have abnormal vaginal discharge that is smelling badly, you should see a doctor. It's better to say there is nothing much and treat it than to not take care of yourself and you now have yourself to blame. Men too, if you have any sexually transmitted infection, as much as possible go and see a doctor. Then if you know as a man that you have sperm problem, it is not the end of the world. There are options for treatment. If the testes are not dead, if the testes are not written off, that they can be drugs can be given to improve the sperm status, we can do that, which will improve the status of the man. But I've treated some men that, I didn't even know that the wife can get pregnant that fast. I just say, okay, let's start treating you. After 3 months of using this drug, let's see the effect. And the woman just got pregnant within a month of starting the drugs. So anything can happen. And if your situation is there is nothing else, your sperm, you don't have any sperm, donor sperm is an option. People are going for donor sperm now. People are going for egg donors now. You have somebody using egg donor to get pregnant. Women are doing it. Women are open to it now, though it's not totally, but the amount of women that are getting open to it are improving. You are the one that will carry the pregnancy. Nobody will know if it's your child or not. It's your child. As long as there is a difference between being a mother and a how am I going to how am I going to put it? A baby mama. You are the one that owns the baby. A woman that carried the baby owns the baby. It doesn't even matter if the egg is not yours. You have carried the baby, and you have fulfilled the purpose of being a mother to that child. You have been true with the child throughout his or her life. The child will not recognize anybody as his mother than you. So it's not the end of life if you are not having sperm. It's not the end of life if you are not growing egg. If you are telling that you need egg donor or you need sperm donor, or egg donation or sperm donation, as much as you can get people it could even be from family members, it could be from father, it could be from brother. It's still your blood. It's just that you are donating it. It's just like when people are getting blood for survival. It's the same thing as getting sperm donation or egg donation. So I will implore people, I will just want you to know that it's not the end of life. Whatever situation you are in, there is always a way out. It may be difficult, it may look expensive, it may be prolonged, but getting pregnant is not impossible. Like that's what I believe. Getting pregnant is not impossible. It may be difficult, it may be stressful, it may be prolonged, it may be expensive, but it is not impossible. So I would just tell you guys to not give up. And also, as much as possible, exercise regularly. If you are fat, if you are obese, as much as possible, both men and women, try and lose weight. If you are a woman, you are obese, you need to lose weight because of the effect on ovulation, the effect on even affecting, they can affect your pregnancy. You can have difficult pregnancy. So it's better to lose weight. If you are underweight as a woman, you should gain weight. So it's not about people that are obese alone. Underweight women will also have problem with getting pregnant. Because if you are underweight, you will not even be menstruating. These are important things. Exercise regularly, eat balanced diet if possible. If not, take supplements, take fruits, take vegetables. These are important things that you need to do. And if you have been trying to conceive for a period of 6 months, if you are 35 years and above, or 1 year if you are less than 35 years, go and see a specialist. Once you can, especially if you are having regular sexual intercourse, because it's very important. A lot of people are not even having regular sexual intercourse. So if you are having regular sexual intercourse and you have not conceived, you should see a specialist. These are important things you need to do. Don't just sit down and be praying alone. People pray and they don't work. When you pray and you don't work, you are just wasting the prayer. And God will help us.
Amen. Thank you so much, Dr. Shea. And so everyone, please check in the comments. It's a pinned one, Dr. Shea's WhatsApp contact. Doesn't matter where you are globally, Dr. Shea can offers virtual consultations as well, or in person. And of course, this video as well. So if you missed parts of it, this video as well will be on Instagram and on YouTube, so you can access it. And please, finally, for anyone that has just joined Dr. Shea, please just remind us, how can we reach out to you if you want to have consultations?
You can send a DM to me on Instagram, ask Dr. Shea, or you can send me a chat on WhatsApp, 080-666-275937. 08066275937. You can send me a WhatsApp chat. You can give me a call. You can book for an online consultation, or if you are in Lagos, you can. I see my patients in Ikorodu, Magodo, Lekki, and Ikoyi, so we can book an appointment for a physical consultation if you are close to any of those locations. Yeah.
Thank you so much, Dr. Shea. Thank you for, for taking the time to answer all our questions and to educate us about male factor infertility and also how to protect ourselves as women as well. This was really, really helpful, and we appreciate your time and your commitment to helping people that are trying to conceive. So thank you so much for all that you do. If you're not following Dr. Shea already, please follow him at Ask Dr. Shea on Instagram. And that way you can follow up with all his communication and information that he puts on a regular basis about fertility, and also following on YouTube and us on YouTube as well. We plan to have this session once a month to speak about fertility, different topics. So if there's any topic that you'd like to get discussed, please send it to myself or Dr. Shea, and we can have that in the future sessions. Thank you all so much. And if I know there were some private questions like cost related or drugs to use in the comments, that can be sent directly to Dr. Shea, and he can let you know what the consultation details are, and he can advise you better. So thank you all for joining us today. Wish you all a wonderful week ahead. Thank you so much, Dr. Shea, again. Have a wonderful week ahead, and bye for now.
Bye bye.
Thank you. Bye, everyone. Thank you for joining us.